Good morning, ladies and gentlemen. How are you guys doing? Now, you're watching Living With Us, and I am your host, Sharon Mundia, and we're here at Park Inn, the 11th floor. It's a beautiful day, and we're diving into a conversation that's a little different from the ones that we've had before. Now, you see, every once in a while, we'll interview people and get to know a little bit about their career paths. And from the people we've interviewed in the past, they've been really interesting and different from what we've normally known. But today's guests, they chose something that was actually conventional. We've got a lecturer, a nurse, and a reverend. And you might think you know what it takes to be all those things, but do we really know what it's about? I guess we'll find out as we interview them. So let's get started. Okay, ladies and gents, so we're here at Park Inn by Radisson, and my first guest registered as a nurse 26 years ago, and she's currently the CEO of Visiting Angels Nursing Agency. Her name is Patricia Bukayagi. Welcome, Patricia.
Thank you, thank you.
When did you know that this was going to be your career trajectory? When did you know that nursing was for you?
I come from a family of nurses.
Ah.
My mom was a nurse. I have two aunties that are nurses.
Okay.
And we did a lot of community work with my mom.
Yeah.
When I was a young girl.
Yeah.
She went around the community with me, and I got to see what it is that she was doing.
Yeah.
So when I finished my Form 6,
Yeah.
I'm from the old system.
Okay.
When I finished my Form 6, then I mean, it was time to make up my mind on what I wanted to do, and I told my mom that I would want to be a nurse, and she said, no.
Why?
Nursing does not have prospects. You know, you'll just be a bedside nurse or maybe a public health nurse, but it will not get you to where I think you should be. And I told her, no, I want to be a nurse. So I got into nursing school, and it was a 3.5 year course, and it was really very fulfilling for me. Many of my colleagues dropped off.
Yeah.
Because it was really a shocker. If you haven't been exposed to the patients and what people go through,
Yeah.
a lot of suffering in the hospitals,
Yeah.
then you will feel that that's not for you. But I was convinced that's where I belonged.
It was your
yeah,
destiny.
completely.
Explain to me, if I was a 3-year-old and I asked you, Auntie Pat, what do you do? What would you say to how would you break it down to a 3-year-old?
Oh, I take care of children and even mummies and daddies that are unwell, and I help them to get better.
Okay,
Yes.
You know, that's a question we've had, because this is a series we've done before with like aeronautical engineers and like conservationists who deal with giraffes, and it's always interesting to like, from that perspective, it's like, how will they explain it? But like, yours is really simple and like well understood, and they're like, oh, okay, I get that, I understand that.
Yeah.
So you take the 3.5-year course. Was there anything else that you needed to do to sort of prepare yourself for this role, getting into your career as a nurse?
When I graduated, I was sure there are certain hospitals that I was not going to work in.
Okay.
Because then I needed to see the impact of my work on my clients.
Okay.
And some of the hospitals that I had interacted with then, they didn't have the facilities that I felt they needed. Because sometimes we had patients, we couldn't get needles, we couldn't get syringes, we couldn't get gloves, patients could die in our hands, and it was very, very frustrating. So I was sure that I was not going to remain in certain hospitals. So I got into the NGO world, and I went to South Sudan, and also in northern Kenya. There was a hospital there for the war wounded, and I worked there for about 6 to 9 months, and I felt now I could come back into the mainstream hospitals. But I went to the private hospitals. I didn't go back to the government, to the public sector. I stayed on into the private sector. I worked in different private hospitals. But after about a year, I knew that I needed to work on my career. So I went back to college. I went to the Catholic University, and I did a postgraduate diploma in project planning and management. So that now got me out of the bedside nursing. So now I got into administration, And it was around that time that I got married.
Okay.
And,
So actually, I want us to go back a little bit, back into the bedside nursing that you're talking about. In your description, you described it so beautifully. You just take care of mummies and daddies and babies who are sick. But I know that this space, and you even touched on it slightly, it comes with a lot of trauma. So how did you deal with it? And did you, going in, did you anticipate that it would be that heavy?
Yes, not that heavy, but I knew it was not going to be an easy ride.
Okay.
Because I remember when I was growing up, I had seen sick people. I had been to the hospitals and watched my aunties and my mom give people injections.
Okay.
So I knew it was not going to be easy, but having the experience myself then put a bit of strain on me.
Yeah.
And I don't know about now, but I would say that debriefing for healthcare professionals is very, very important. Okay. I'll talk about that later.
Yeah.
And I needed a bit of debriefing.
Yeah.
And in one of the hospitals that I worked in, we had those sessions where we could sit in the morning and the sister in charge would take us through what it is we've gone through. I used to work in the accident and emergency department, so you can imagine. We used to receive it fresh. Many people don't think about it.
Yeah.
But when you ring the emergency bell, there's the nurse that comes to receive you.
Yeah.
She doesn't know what's on the other side of the door.
Yeah.
So when she opens and you rush in, you have expectations. You expect that nurse immediately to know what to do and to respond to you.
Yeah.
There are those that come in screaming, there are those that come in crying, and there's a mother who will just hand you a baby. You don't know whether that baby is alive or not. So it's up to you. So you've really got to be on top of your game. You forget yourself, literally, and put yourself in the shoes of this mother, but what it is that you are supposed to do. And that's the training. That's the training. So, and many people say, nurses are so inhuman. They inject you and they know you're in pain. Yes, we know you're in pain, but we are focusing on getting you better.
Yeah.
Because if we don't do that, if I don't get you on oxygen immediately, then your condition deteriorates.
Right.
If I don't give you that injection immediately, then we will have a problem.
Yeah.
So we always work with the end in mind. And that's why we do what we do, the way we do it.
Bless.
Yeah.
So your career trajectory changed a little, because when you went back to school, you sort of shifted, away from like the bedside nursing to more administration.
Yes.
What's that been like for you?
Oh, that has been very fulfilling, because now I am able to impact more directly on what should happen on the ground.
And what do you mean exactly?
From a management perspective.
Okay.
I'm able to train, I'm able to teach the nurses. So my expectations of the nurses is a little higher.
Yeah.
Because I know what it is that they should do.
Yeah.
And I'm able to impact that. If you don't have the knowledge, I'll help you get it.
Yeah.
If it's a personality issue, we will handle it. If it's a knowledge issue, we will handle it. So I'm able to impact that now from my position.
Yeah.
And I've been through different levels in management. Again, I at some point I left the hospitals and now joined the corporate. And I got into medical insurance.
Okay.
Along the way, I had come across a pretty new concept then that was called case management, which was a very insurance-based kind of training. So when I got into the medical insurance, my role again was to train the nurses that I found in the medical insurance field on these aspects of case management, which is very popular now. Every insurance company now has got care managers. And what that is more on balancing the benefits management. Every policy has got its own benefits, where you're told you have your outpatient cover, your inpatient cover. So we help you to manage that, but and get the maximum quality out of your benefit. Now, that's a very delicate balance.
Wow. And to me, I find it so interesting. Did you have any idea that this is the path that you would take in your career? And I'm also curious to know what your mom later thought about it when she saw the different stages in which your career trajectory sort of shifted into.
My mom has been supportive. When I told her that I want to go into nursing, and I kept going on and on.
Yeah.
Actually, she didn't expect me to finish the 3.5 years.
Yeah.
So when I graduated, she was like, "Okay,
Wow, she's
this
serious.
one is made for it."
Patricia is
So
not
she
joking.
completely, and she has been very, very supportive.
Okay.
She has watched me grow through all the stages.
Yeah.
And it's now that she's beginning to piece everything together, which I will share with you as we discuss this journey.
Yeah.
Because she was a very, like I told you, she was a public health nurse.
Yeah.
So she dealt a lot with the community. And I have ended up in the community myself.
Yeah.
So now she appreciates it.
She gets it.
Yeah. But I didn't know which way this would end up.
Yeah.
I just appreciated every step of the way.
Yeah. So how did you get to be the CEO of, is it Visiting Angels Nursing Agency? Can you tell me about that?
I was in the medical insurance field for about 15 years. And at some point I said, there must be something more. And I started by flukes. Let me call it by flukes.
Yeah.
I was beginning to get very interested in home-based care.
Okay.
Home-based care, which many people call home health,
Yeah.
where nurses come or caregivers come into your home to take care of you. That was about 2010, 2009, 2010. I was beginning to get very, very interested. And I wondered, who does that here? Okay, do I do it or not? And by flukes, a friend of mine called me, a friend of my mom called me and told me, I've heard you talk about home health. I have a friend who needs a nurse. Can you come and do it? And now, remember, I was working, so I had to get a caregiver to go and offer this service. And I got some money out of it. And I said, oh, okay, it works. So I registered the company about 8 years ago. And but along the way, remember, I'm still in employment.
Yeah.
Along the way, the company grew. And I said, I think I can do this on a full-time basis, but I need certain skills to drive this. So I went to Strathmore Business School. I did an executive course in managing healthcare businesses.
Yeah.
And it's a 6 months course. 2 months into the course, I was sure that now I'm ready to leave employment.
Yeah.
And that was 5 years ago, and I left employment.
Look at that.
Yes.
And you also started a not-for-profit Angels Healthcare Network.
Yeah.
What is that about? First of all, I have to say, even before you continue, it's so interesting to me how, I guess, when you just think about a nurse, you just think there's just one career option. It's just this one thing that you do, which is, and yet you've sort of gone against the grain, brought in a little bit of business, a little bit of boss lady into it, and a lot of passion. And I find that so fascinating, which is why I think this show is exciting, because we're showing how what most people would think is like, oh, okay, I know what that's about. I know what nursing is about. I know what lecturing is about. Has shifted quite a bit, and your story is a testament to that. So yeah, so going back to Angels Healthcare Network, what's that about? Yeah.
Another twist. When I now got into full-time home-based care, and we are moving from home to home, and we have all these people we are taking care of, I noticed, before then, I was now enlisted to run a home for the elderly, a residential facility. Okay. And I don't know how they got to know about us. They just came to the office and they told me, Patricia, we've heard about you. Please, we need someone like in 3 weeks. And I said, 3 weeks. So we got onto it. Yeah. And there was this home with about 25 to 30 older ladies. Yeah. It was a ladies only, a very Mzungu place. Yeah. And we were there. We had our workers there, caregivers, and we started working. Yeah. But along the way, and you know, we are taking good care of them, they're in good health, they're happy. But I now came across this other group that is not in the home, they're in their own homes, older people. And I'm saying, there's a disconnect. The ones in the homes are not as happy. We are beginning to get challenges. We are seeing malnutrition among older people. We are seeing them with bed sores. And there's a problem. But and then I said, oh, maybe it's a money thing. Maybe some can afford, others cannot afford. And I said, no, because it didn't matter, the social status. It didn't matter. There was malnutrition we were seeing in the lower end and in the high end as well. And I said, there's a problem. So I started wondering, you know, who takes care of older people? What happens when people age in this country? And I started now doing my own personal research to find out, and what is it that how can we contribute? And that's how Angels Healthcare was born.
That is incredible. So as we wrap this up, because I know we have to take a break soon, what would you say to someone who's looking to come into the industry, who's maybe thinking of becoming a registered nurse, and what would you say to them now about their career?
I would tell them to go for it. It's important to be sure. It's scary. So you've got to be sure. You must have the resilience. You sometimes cry. Because you get attached at some point. It's not. We always say, you know, don't get attached to your patients. So, but it's not possible. Sometimes you see this child who is really, really suffering. You've got to have the skills to kind of separate yourself, so that then you don't get too emotionally involved, otherwise it will destroy you. But also, it's good to feel with the people. It's good to feel with your patients. Let them know. We call it empathizing. You empathize with them, but you've got to be careful that you're not completely drawn. Otherwise, then it destroys you, and you're the caregiver.
Oh, thank you so much, Patricia. Thank you for sharing your story and for inspiring others to know that that you can also create your own path in this space. Wow.